Good morning. This is the team of South Sudan Youth Organization Coalition press statement for immediate release on the date of 7th April 2020 on confirmed case of COVID-19 pandemic in Juba, South Sudan. We members of South Sudan Youth Organization Coalition, in connection with the Ministry of Health, high-level task force, and partners within and at the borders of South Sudan, therefore would like to thank the government, high-level task force committee, and partners who have joined forces to prevent the spread of coronavirus in South Sudan. We continue to acknowledge government's Ministry of Health, World Health Organization, and partners and public holding on partial lockdowns of airports, South Sudan borders, closures of schools, churches, bars, clubs, sports, wedding ceremonies, reduction of passengers in public transports to encourage social distancing, cinemas and betting centers, half-day working hours, closures of shops with non-food items, and other social gatherings to prevent the COVID-19 from spreading. However, following the press release from the Presidency, High-Level Task Force Committee on the 5th April 2020, confirming the first ever case of COVID-19 in the Republic of South Sudan, shocked the public and sent mixed reaction to the public, especially on the dates the patient arrived in the country and the time she was tested positive of COVID-19. That surpasses the normal time, the expected symptoms within the 14 days to more than a month. Knowing that South Sudan is part and parcel of a global village and is not, however, exceptional to the pandemic COVID-19 unfolding tragedies affecting health, social and economic lives of everyone, of every mankind, regardless of race, color, and boundaries. The coalition, however, would like to demand the government and partners of South Sudan, especially the COVID-19 task force, to urgently take the following actions in effort to prevent and reverse the tragedy of COVID-19 with one confirmed case already in the country. We demand that the government and the UN to provide convincing medical clarification on the already confirmed COVID-19 case in the country. The patient surpassed the normal time of signs and symptoms of the virus in the human body, which is 14 days. We demand the test of all UN staffs, and it must be done by the Ministry of Health of the Republic of South Sudan. We demand all businessmen, well-wishers who wish to support or donate food items should hand over to the Ministry of Humanitarian Affairs in respecting the COVID-19 guidelines. Strictly follow up on the tests and quarantine for those who have already previously interacted with the current COVID-19 positive patient. We demand the business community in South Sudan to support the government with facilities, materials, and food to respond in combating COVID-19 outbreak. We urge the government to stop all UN international flights and restrict their internal movement in the country immediately. Resources to fight COVID-19 we urge the government to release the resources to fight COVID-19 immediately to the Ministry of Health so as to equip the isolation and testing sites across the country and at the borders. The government must support national and state health facilities across the country to help fight COVID-19 prevention at the grassroots. We demand systematic awareness and consideration of all IDPs and POC sites within the country and provide all necessary prevention kits. We demand the high-level task force against COVID-19 to speed up and widen the coordination mechanism at the borders and states with different stakeholders across the country. We urge that the high government officials continue to respect and implement the presidential orders against COVID-19. We demand that the government must install state leadership immediately in the 10 states and the 3 administrative areas to bridge the leadership gap in preventing COVID-19. We demand that the high-level task force put communication plan to aware the public on the location of the centers meant for testing and quarantine for public ownership and references. We also demand that the bus parks and markets are provided with washing and preventive kits and hand washing equipment, including detergent. Thank you. For questions? If the incident manager comes publicly and tells us that they're running out of kits, then we are worried, because it is the government's responsibility either to mobilize resources. They should lobby for resources from their partners, or they raise funds. They have the resources. They can take loans. They have been taking loans on many things, on things that even are not very important. So why not borrow money now that we feel we need it? It is about people's lives. So if we need more testing kits, there's no way they can tell us that they don't have resources to provide for such important resources that we need right now to fight this disease. They should have open up for all sources that they can access resources to fund this immediate need of the testing kits.
We remember when the issue of the COVID-19 started in South Sudan, in the world at large. South Sudan had to put measures to ensure that they prevent the virus from getting to its people. They had a budget. And to me, I feel if he's asking such a question, for us as civil society, we would be asking them, how much have you spent from the budget that was allocated for this COVID-19 for South Sudan? Because up to now, we don't have accountability how much money was spent. We were with the minister last week, and she was talking of, she got some little money, around 5 million or something of that kind.
She placed a budget of $5 million US dollars.
Yeah, but the money was also over. The question is, where did this money go? This was a huge amount of money. What we know is part of the money went to the students, but still the students are complaining. Yeah, Addis had a problem. Uganda soon will also have a problem. So where did the money go? To me, we really need them to ensure, tell us how they spend the money that was allocated at first, and also urge the government that it's true they should get more loans for this, because if there is loan, and if they have partners, we also have the oil. Why can't the oil not be sold? Those prices are low, but we get the money and save the people of South Sudan.
Okay, thank you. Our statement is very clear. Basing on the confirmed case, we want clarification. The normal days for the virus to incubate is 14 days. Why is South Sudanese case different? Why does it have to go to 30 plus days? We want clarification. They should come up and tell us what happened. If it is either this person contacted this disease within South Sudan, or they should tell us what went wrong, what happened. Since she came on the 28th of February, we are in March, and we reported the case on the 5th of April. So it is surprising worldwide. We are confused about the whole scenario. They should come out clearly and explain to us. We want to understand. Is South Sudan unique from the rest of the world? We want to know this. Okay, just to connect it with what Garang asked. People now are coming up, they want to test. Even I feel like I should go for testing. But now if the ministry is telling us they are running out of the kits and they are going to test people specifically with signs, it is already a threat to us. So I really don't know. There is a testing center, fine, but if without testing kits, it is not going to carry any effect. It's not going to create any impact. So it is just up to the government. They should look for means, because people cannot go out start begging for testing kits for the government. They have all the connections. They have the partners they've been working with. So they can still go back to these partners. If it means getting loans, let them do it, because our lives is at stake. And it is not just other people's lives, all of us, them inclusive.
I think we have been also urging that there should be a number of them. And the facilities look not to be there. We only have one, and that makes it more dangerous for people in South Sudan. There are a number of people who want to go and test voluntarily, because it's important. This lady, for instance, let's talk about her. She came to this country on the 28th, and she works with the UN. Now, what beats also my understanding up to date, you cannot know which UN is this lady working with. I was yesterday, somebody told me the lady works with the UNDP. Now, UNDP, which department in UNDP? Because we need to, these are the information that the public needs. Yeah? Which UNDP and which kind of, because she met people. you try to connect, they say she met people who came from Torit, who came from where? So what is this that she's doing in South Sudan? Because it helps. Maybe she's somebody who works with our grassroots people. She traveled to the states, different states. So these are the information that people want to know, basically. And for the centers we have also had the minister, we are closely with her. We had a meeting last week, and we are telling her to declare more centers for testing, not only here, even the hotspots at the borders, basically, you see? Because those are the borders where all this is happening. So, but we will continue engaging the ministry and see a way out that they have more of this, because now people are coming voluntarily to test. And when you have a discussion with them, they say there are people who want to test. And one thing that I want the media, that we also as the civil society demand is, what is this special with people from the government being taken out for treatment? So we need more, we need more improvement in our health system than telling people at this critical moment you have closed the airport and you still add some special audience for other people to go out. This makes it more dangerous for us. We are not understanding why should some people go. And the country even you're taking these people is more worse than South Sudan at the moment. Yeah? So when you say, because we have been hearing this on media, so it would be good if we have this information. I said from day one that this is a kind of pandemic that doesn't have secrets. So we also had the government to continue getting up and tell people, give clear information about what is happening. Take all the precaution measures that will help the population. But as we do this, there is need for support and there is need for information sharing from the government and the task force and even the international community. Because to me, if this woman was locked up in Unimis all this time, or where she was, for all these 39 days or 40 days or 35 days, without us knowing until we realized later. My colleague was saying, are we unique? Or we have a different COVID-19 designed for South Sudan, that somebody comes out after 35 days or 40 days. We also need the World Health Organization to help us on this, because people are really confused. The public needs information.
On what we are doing, we have also managed to get in touch with people at the local level, most especially the foreign communities, the Ugandan community, Kenyan community. We get information, the facts that we can access. We share it with them so that they can also go out down to their communities and sensitize their people. Because these people, these foreign communities that are doing business in South Sudan, they rely on information from their community heads, their community leadership. So we are engaged with those communities. We share information with them so that we can cover up a bigger audience to create awareness on COVID-19. And in case of any suspects, they get back to us and we help out on how to connect with the ministry in case we have suspects and see how they can be taken for testing and quarantine. For the civil population to access information in the meantime, right from the task force, first of all, there is a loophole in leadership across the country. We don't have state leadership. And the best way the information that will run from the task force would be through the ministries of health at the state level, which are not there. They are not in place. So it is very difficult to channel such informations. But if they can use maybe some form of IEC materials and share them across to the health centers within the states, the people can easily access them. They can access it and maybe translate them according to the local languages of those communities. It can be easy for people to access information. We also urge the government to urgently install the state leadership. It is very important. A state cannot run without a ministry of health, a minister of health at this critical time. We need them to stand up and speed up the process of installing this leadership.
Yes. What I can you know, the issue of COVID-19 is not perceived in South Sudan as a real tragedy, as a real health problem. And as you see how the high-level task force is responding and is operating, coordination and inclusion is not up to date. You see they have more than 15 or so high-level meetings, and all these high-level meetings have not been able to even approve the funding that will be used to take awareness raising to the grassroots. It has not been used to establish isolation and testing centers completely. Then why? I mean, how do you have a high level that doesn't use resources, that doesn't dispatch the right human resource to be able to reach to the people, to aware the population? So what we see there is that there is a huge gap, as you've had already. There is a huge gap in coordination and monitoring the issues, and that needs to improve.
We still had the task force, the way one of us was saying this. They seems not to be connected with people. You see this? The task force is doing its executive stuff, and then when you go to the ministry is doing its part as a ministry. What will be hard for us is where these issues of mistrust, until they will have to say we are going to import doctors from China, we are going to do this from China, is because of the mistrust. We said in recently that we have very experienced doctors. Yeah, we have associations of medical doctors who others are ready to volunteer. You see, there are people who are ready to volunteer to work for the interests of the country. But now when you see with the executive at the high level, the question is all about, is it the resources which are put there? Yeah? Because you get every person is saying the high level, and what comes out of the high level committee is only about press statements. Yeah? There are no concrete steps forward. Release the money, do this, let's get more ventilators, let's do this. We don't have even, we are urging other business community to ensure that they give their hotels to be facilities for this. Because there are no facilities now. You hear this is the only place we have for the test, and this only place you get, it cannot take, I doubt whether it can take over 100 people.
Not even 50.
So tomorrow if we have a huge number, where do we take them? Yeah? So where do we take these people when we have huge numbers? And we are not looking at that. The other thing is this. I think maybe when they come up with the next press statement, we will be more shocked than ever, because the numbers might have gone excess. And we cannot, because it's still one, we don't know what will happen in the next press statement. The number might be more, and you don't have the places. Now, if they don't have even a place where you can test me voluntarily, then what about when we are all in critical situation? So we are just, there is need for the high-level task force, disperse these resources to the Ministry of Health, let them do their work, and the quick response team. If we have been seeing this, there are a lot of delays in doing things, the testing, samples are brought from other states, and they are taken back. So there is really need of more effort to be done.
To add on that, there is also a very big gap between the task force and the doctors on the front line. We've had scenarios where doctors are protesting. They are not involved in the process. They are not consulted. They have not been trained. How are they going to address this issue? So it should stop being, now that we already have a case, it should stop being a high-level meeting, other than getting it to the hospital and train doctors, prepare them. It is not just a matter of just preparing them on how they are going to handle the people. They also need to be prepared psychologically. This is a very big problem between the high level and the doctors at the front line. How are they going to handle this issue? They don't have the medical equipment in place. They don't have the preventive gears. They are not informed. They are totally left out. So it is only for the press, for the high-level task force to announce. Then who will take care? Okay, if this was not a UN staff, Just imagine he or she was a normal South Sudanese. Which doctor will go and start attending to this patient? There is a very big gap. So they should stop making it a high-level meeting and engaging the doctors on the front line, the doctors to handle. This lady is lucky. She's being handled by UN doctors. What about if it's a normal South Sudanese? To some point, I think the persons they want to evacuate, it is obvious they don't trust, they don't want to engage our doctors in this whole thing. So we should stop this high-level gathering and get back on the practical part of it. So this is what I can say.